Hi there, my name is Ryan, and today I'll be presenting on tick paralysis in dogs. We'll be focusing on Ixodes polycyclus, being one of the most dangerous tick species affecting dogs in Australia. I'll be covering its life cycle, how the toxins work, and the critical signs, diagnosis and treatment and prevention, as well as a wider impact of this condition. So, as we can see here, the tick starts its life cycle out as an egg, which develops into then a larva, then later into a nymph, and finally a mature adult. They are primarily found along the eastern coast of Australia in warm, humid, bushy areas. As we can see the trends here reported on the graph by Tio, just along here. They peak around the spring and early summer, completing their life cycle with all stages requiring blood meals, which mostly get from bandicoots, these little guys up here. This means that dogs are incidental hosts. Because of this, they don't develop a strong immunity to the toxin. This is why just one tick can be fatal. But why is it fatal? Why is it deadly? Well, the toxin is called oligocycline toxin, and it is produced when in the saliva of the adult female tick when she feeds. Once injected, it enters the lymphatic system and spreads through the systemic circulation. This toxin targets nervous system by blocking the voltage gate calcium channels and on the presynaptic motor neurons. That blockage prevents the release of acetylcholine at the neuromuscular junction here. And without acetylcholine, the signal from the nerve can't reach the muscle, leading to progressive muscle paralysis. The early signs of this progressive paralysis often include lethargy, change of bark, vomiting, inappetence, and urinary incontinence. And as the toxin load increases, weakness develops in the hind limbs, which can be shown here, as the dog's dragging its back legs, paws, and that back. I know it's a German Shepherd, but the back is rounding down. You can see the beagle down here. This paralysis doesn't just stop there. It can also spread to the forelimbs, and also cause facial drooping, drooling, and difficulty swallowing. And this can lead to more severe cases where the esophagus, pharynx, and larynx become paralyzed, leading to regurgitation and aspirated ammonia. If the toxin continues to spread, it may affect the diaphragm, resulting in respiratory distress, respiratory failure, and this is the most common cause of death in this case. Okay. This is why early diagnosis is so important to prevent these symptoms from progressing to the life-threatening stage. The diagnosis is mostly clinical, relying on patient signs, history, tick exposure, and preventative history, and where they're located. Finding the tick itself, or a crater in which it leaves behind, is a pretty good clue that it has had the tick. Most often found around the head, neck, and shoulders, which are pointed out here in this table. Sometimes blood work can be done, though it usually is non-specific. But it can reveal secondary changes like elevated liver enzymes like ALT and ALP, and elevated inflammatory markers like leukocytosis or neutrophilia can be seen. We also use a tick scoring chart, which assesses the severity of the condition, which combines a gait score and respiratory score, with a gait score going from mild weakness to unable to right themselves, unable to walk or stand, and a respiratory score going from normal to open mouth breathing and just respiratory distress. Once a diagnosis is confirmed, treatment must begin immediately, ideally within the first 24 hours to prevent further progressive of symptoms. The first step is to remove the tick using forceps or tick hooks, making sure not to induce more envenomation, and making sure to remove the entire tick. In moderate to severe cases, the most effective therapy is to administer tick antiserum. Here we can see a vial and the instruction sheet. This is actually the bottle that we use in the clinic I work at. And even though it has been cold, we have still used quite a lot. This antiserum contains antibodies from hyperimmunized animals. When given slowly through IV, it neutralizes the circulating toxin, stopping it from causing animal damage. In addition to this, supportive care is critical, such as IV fluid to maintain hydration, repositioning recumbent patients every 4 hours to prevent bed sores, lubricating the eyes to prevent ulcers from developing as the eyes can dry out, providing pain relief and antibiotics for any secondary infections or injuries that may have occurred. So we've talked about treatment, but of course, the best strategy is prevention. Isoxazoline based preventatives such as NexGard or Brevecto work really well. Here we actually have Brevecto products in which we use in my clinic. We've got the Brevecto Chew, which lasts about 3 months, and the Brevecto Spot On lasts about 6 months, or the new Brevecto Quantum, which is injection that goes subcut, can last up to a year. These products work well because when the tick bites, it injects a small amount of the drug, ingests a small amount of the drug, killing the tick quickly before it can cause any harm or inject any more venom. In addition, we recommend daily tick checks during peak season, especially around the head, neck, and shoulders. And owners should also try to avoid high-risk bushy areas during spring and summer when the ticks are most active. And finally, owner education is critical. Knowing what signs to look out for, what means a faster action, and faster action saves lives. The reality of tick paralysis is still a huge impact on animal health and the wider community as a whole. Veterinarians see around 10,000 cases every year in Australia caused by Ixodes holocyclus. Treatment can be also very expensive. It can cost owners up to $10,000 per dog in some cases, normally around 5. And for farmers, the loss of a working dog means not only financial strain, but also productivity loss. And finally, these cases take an emotional toll on the owners who may lose their pet, and on the veterinarian staff who work tirelessly to save these dogs' lives. I couldn't actually get permission from owners of their dogs getting treated, but here is my handsome boy Blue getting treated. So in conclusion, tick paralysis is caused by Ixodes holocyclin toxin, a potent neurotoxin from the paralysis tick Ixodes holocyclin. It acts on the neuromuscular junction, blocking nerve muscle communication and leading to progressive paralysis. Early tick removal and antiserum remain life-saving treatments and gold standard, but ultimately, education and prevention are the best defenses protecting dogs before the toxin can take hold. When measures come together, we can reduce cases, saving lives, and lessen the burden on both owners and veterinary staff. Thank you. And those are my references.